Hi, my name is Anand Nayak. I am chair of the Department of Management, Policy, and Community Health, and a professor here at the School of Public Health and in the medical school.
My name is Dr. Laura Uribarri, and I am an associate professor within the healthcare management program in MPAC. I also wear a second hat, which is that I serve as the program director for the healthcare management program, and I am based out of the El Paso campus.
I'm Dr. Gingeraya, and I am an associate professor with UTHealth in the Department of Management, Policy, and Community Health.
I'm Jack Tsai. I'm Regional Dean and Professor of UTHealth School of Public Health, and I'm in the Department of Impact in Community Health Practice.
I'm a medical geriatrician as well as a health services researcher, and so I lead at UTHealth Houston the Institute on Aging, which is really a cross-school institute, but certainly has a very strong presence in the School of Public Health and in our Impact department. And that really is where I do a lot of my research through, is the Institute, and really focusing around healthcare, health, and life outcomes of older adults, often those who have multiple chronic conditions.
I come from a community that is very medically underserved, where resources are quite scarce. I come from a border community that is often really the sentinel, right? The front door to many serious public health challenges. And what we do here in public health matters, and what we do every day in terms of giving our students, helping our students with the skills to develop the capacity, the competency to serve and rise to those challenges is really critical.
I think what makes the Impact department stand out is there's just so many things. First of all, I was very impressed with the students themselves. I think it is something rare for you to see such diverse student backgrounds. I've never had a class where you see physicians and dentists and social workers and executives and epidemiologists and just so many individual students that are in industry or that are looking to lead in industry and that have this interprofessional way of leading and really changing how public health will be and is. So I find that extremely interesting and inspiring.
So a lot of my research is applying public mental health interventions to society's pressing problems. So I do a lot of work on homelessness, severe mental illness, and I work primarily in underserved populations, including veterans and low-income populations. We have various projects. One project, for example, is based in San Antonio, helping homeless and at-risk veterans manage their money and gain financial literacy with the hope that helping them manage their money will improve their behavioral health and their quality of life.
So I think Impact faculty really focus on how what they're doing makes a difference. You know, if you think about community health practice, we have faculty members who are tackling big questions like homelessness and how do people improve their life and health after they've been incarcerated, substance abuse and challenging things. In healthcare management, we're really tackling the big questions in terms of the quality of care that's provided, the arrangement of care. How do we improve the care that people receive? In health services research and health economics, we're focused around obviously on the economics of it, the cost of care, how do we reduce cost? How do we think about value? What does that mean? The arrangement of care and how it's delivered, the services provided. So it's really quite a diverse array of things people are focused on, big questions that tackle both healthcare, the transitions from healthcare into the community, and the community more broadly.
We are MPAC.
We are Impact.
We are Impact.
I'm Gordon Shen. I'm an assistant professor in the Healthcare Management Health Policy program. My research touches on management innovations, and that takes into account culture, context, and customization. And so with my advisees, I also tend to touch on any of the phenomenon that spans management, global health, and mental health.
I'm Heidi Russell. I am a professor in the Department of Management, Policy, and Community Health, but I'm specifically in the Healthcare Management program. My research is generally in the costs of healthcare. Lately, I've been doing some research in precision medicine for cancer and the costs of that. And then, but I'm kind of interested in all things cancer related for children.
My name is Rafael Samper Turnant. I'm an associate professor in the department. I'm part of the Health Economics and Health Services Research Program, and I'm also the lead for the Clinical Research and Innovation Core at the Institute on Aging. So in terms of research, I work with Dr. Nayak in the Patient Priorities Care Lab, where we focus on clinical innovation for patients with multiple chronic conditions and dementia. And we are conducting several clinical trials testing the patient priorities care intervention in the geriatric clinics at UT Physicians.
My name is Vanessa Shik Sai. I am an associate professor within MPAC with a focus in community health practice. My research focuses on, it's all community-centered, community-driven. I work with various historically disenfranchised communities, but I primarily center focusing on the experiences of individuals who are experiencing homelessness or houselessness, folks who are involved with our justice system, individuals engaged in transactional sex work.
What I like about our department are just, wow, all the letters that are in the name, but really it's an interdisciplinary department. And I think when you talk to any of my colleagues, like there are just so many new ideas that can come about, and so many new possibilities when we collaborate in teaching, research, or service.
MPAC is what makes MPAC strong. So the fact that we cover everything from management to policy and community health speaks to the work that I've been doing for the last decade. So the fact that we can impact healthcare systems, that we can analyze and discuss how policy impacts everything that we do in healthcare systems, and that we position communities, the communities that we impact at the center of what we do with the community health part. I think it's what makes us unique within public health, but also unique within the Texas Medical Center and the work that we are doing in Texas.
All the faculty and staff seem to be dedicated to what we're trying to do as a department, to both our research efforts, our community outreach efforts, and to educating our students.
We are MPAC.
We are MPAC.
We are MPAC.
Well, my name is Flora Kwan, although I go by my middle name Tiffany. I am in the DRPH program in community health practice. I pursue my MPH the previous 2 years in the same community health practice department.
My name is Jack Banks. I'm a postdoctoral research fellow within the MPAC department, and my primary role as a health system scientist within the department is evaluating primary and secondary outcomes associated with trials surrounding patient priorities care.
Hi everyone, my name is Syed Hussain. I completed my master's in healthcare management at UTHealth before transitioning directly into the PhD program.
My name is Tony Stallings. I am a MPH in healthcare management.
I'm Mukund Nair, and I'm a Master's of Public Health student on the Community Health Practice track. I also serve as the current secretary for our MPAC student board and also serve as the communications graduate assistant for the department.
As an international person within the department, I think it's such a strength that we have so many people from around the world who come from different places and who have different lived experiences of living and working in different parts of the world. I think that's a huge strength and something that the department should be very proud of, that so many international people are here and feel so welcome and stay here.
The remarkable strengths of the department, I would say the faculty members. They have wide experiences, they have different interests, and then they enrich the courses, and also they help us as students transition from the theoretical concepts into the implementation and putting into practice in the real world.
In my experience, the people at the MPAC department are some of the best people that you'll find. You can go to any person and ask them for help, and all of them will be more than eager to help you out with anything or give you advice on any projects you're working on, any classes, or just career advice.
It's very special to be a student in the MPAC department because all our coursework is so intimately tied with community work. Rarely do you see, especially in our major, which is community health practice, rarely do you see a class which doesn't have a community involvement aspect to it. So community involvement, community service is baked into the curriculum that we are going through for 2 years. And if we're learning it in class, we're expected to apply it and to help out other organizations in the city. And for me, a Houston native, born and raised in Houston, there's nothing more special than being able to give back to that community that gave me so much growing up.
We are MPAC.
Es MPAC muid.
Somos MPAC.
Hum hai MPAC.
We are MPAC.